Good afternoon. Last month, the U.S. House of Representatives passed H.R. 1, the One Big Beautiful Bill Act. This is a sweeping proposal that will shift hundreds of millions of dollars in new costs onto counties like San Diego. Every Democrat voted no, and nearly every Republican voted yes. If this bill becomes law, it will gut federal support for healthcare, food, and housing, and push that burden onto local governments like ours without any staff or resources to handle these new mandates. These changes are real, and they are moving forward. The legislation has already passed one chamber of Congress, and the potential cost to the County of San Diego is enormous. That is why we are here today, to walk through the county's initial analysis and to lay out the steps the county must begin taking immediately. Let's begin by talking about Medi-Cal, California's Medicaid program and the foundation of healthcare for nearly 900,000 people here in San Diego County. The bill passed by the U.S. House would overhaul how Medi-Cal works and dump massive new responsibilities onto San Diego County. Based on our team's analysis, the bill's changes would have three major impacts on our region. First, it would more than double the eligibility workload. Under the bill, every single San Diegan on Medi-Cal would be required to re-verify their eligibility twice a year. That means a huge surge in paperwork, hotline calls, appeals, and office visits. And it would roll back real progress we've made over the last few years. Since 2021, we've led the way in modernizing access to care by streamlining applications, boosting staffing, and cutting wait times. Thanks to our Make the County Work for All initiative, Medi-Cal applications in San Diego are now processed in just 23 days. This compares to the state's average of 45 days. This means faster doctor visits, quicker prescriptions, and help that arrives before a crisis gets worse. But our progress is now at risk. If we do not scale up our staffing to meet this new federal mandate, wait times will spike and families will be left waiting weeks for care. People will fall through the cracks. Not because they're ineligible, but because they got stuck in the paperwork and could not reach someone in time. So if we fail to prepare for the changes in this bill, coverage losses and care delays are a certainty. And the downstream costs in healthcare outcomes, in emergency care, and human impact will be even greater. That's why the plan we're introducing today begins with a full staffing and operational readiness assessment to protect what's working and prevent a surge in delays or lost coverage. Second, new federal work reporting rules will add red tape and increased costs for everyone. These federal work reporting rules are an enormous burden. The bill would impose these new reporting requirements on Medi-Cal enrollees across San Diego County. While encouraging work is a goal that we all share, the way these rules are designed has proven enormously harmful elsewhere. In other states like Alabama, these rules have not increased employment. Instead, they've increased paperwork, errors, delays, and administrative costs. In other words, people who need health care are drowning in bureaucracy. People lose coverage, not because they're ineligible, but because they missed a form, changed jobs, or uploaded a document in the wrong format. That's more than 880,000 people, nearly 900,000 San Diegans, who need and deserve health care, trying to navigate impossible new bureaucratic requirements and creating a massive burden. When these folks fall through the cracks, it does not save money, and it actually just shifts costs. The costs are shifted to hospitals, emergency rooms, and crisis care. Let me say that again. When people lose access to health care, this does not save costs. It just shifts costs so that we're all paying the price. That's why our plan here in San Diego County includes an early action strategy to assess staffing and support needs to make sure eligible San Diegans do not lose health care because of red tape or paperwork mistakes. Third, the bill contains a $10 million annual hit to our behavioral health care system. This bill would cut the federal match for Medicaid services, costing San Diego County an estimated $10 million per year in funding for mental health and substance use treatment. Right now, California receives a 90% federal match. This is known as FMAP, for covering low-income adults that have been made eligible through the Affordable Care Act. Before the ACA, most adults without children did not qualify for Medicaid at all, no matter how little they earned. This funding changed that and helped millions receive coverage, including over 350,000 people now in San Diego County. But this progress is on the chopping block. The bill would drop the federal match from 90 to 80%, a 10-point cut. In real dollar terms, this is a $10 million annual price tag for our region. These matching dollars directly support care for Medi-Cal enrollees. Losing these beneficiaries means a smaller pool of resources at a time when demand for behavioral health services is rising. Let me tell you in real terms what that means for us here in San Diego County. Since 2021, we've added over 5,000 new behavioral health treatment slots. These are places where people can get access to mental health care and addiction treatment services. We've also launched mobile crisis teams that bring care to people before they end up in jail or the ER. And we're not stopping there. We have plans to add 16,000 more treatment slots by 2030. But none of these plans account for a massive federal retreat. If these cuts go through, we'll have fewer tools to keep people stable, and more people will spiral into crisis. That means crowded ERs, overwhelmed first responders, and psychiatric facilities pushed past the breaking point. That's why we're calling for immediate planning to make sure our behavioral health system can absorb these cuts and continue delivering the care that San Diegans rely on. So yes, this proposal is about protecting county systems and reducing federal costs and avoiding downstream crises. But at its core, it's about protecting people. There are real people behind every single statistics. Families who count on Medi-Cal to go to the doctor, workers who rely on mental health care to stay on track, seniors managing chronic conditions, trying to stay independent. And I know what that feels like because I've been there. 5 years ago, when I had my daughter, I was running a small business and trying to make it work as a single mom. We didn't qualify for ACA subsidies, and the only option was Medicaid. Thank God for that. So that's what we're fighting to protect, not just numbers in a budget, but peace of mind, a doctor's visit when you need one, a blood pressure check before a stroke, a therapy session that helps you stay sober, stay grounded, stay here. These changes may not hit until next year, but if we wait until then, it will be too late. So that's why this plan starts now. Staffing assessments, operational readiness, and a clear fiscal strategy. So when the cuts come, we're ready, and the people who count on us do not pay the price. Now I'd like to turn it over to my colleague, Supervisor Montgomery Steppe.
Thank you so much, Acting Chair Lawson-Remer, for partnering with my office on this. Good afternoon, everyone. And it is very important that right now we paint a clear picture of what's at stake. This is not a hypothetical situation. We have heard the plans over and over again. And by design, the authors of House Resolution 1, along with the President, have gaslighted the American people, trying to make them believe that everything is awesome. The truth is, this bill is moving through Congress. The truth is, this bill will have significant consequences for millions across our nation. And the truth is, local governments like San Diego County, who are tasked with delivering essential health and human services, will struggle as a result of this bill. Too often, government is reactive. There's always a sense of regret that we didn't do more to prepare or prevent catastrophic events that devastate our communities. Right now, we have an opportunity to act in advance because failing our constituents is simply not an option. H.R. 1 represents one of the most aggressive federal disinvestments in core safety net programs in decades. It would shift hundreds of millions of dollars in costs to counties like San Diego. These are costs that we were never meant to bear alone. As an elected representative for a district where 104,000 residents rely on CalFresh and hundreds more rely on federally funded housing and homelessness programs, I can tell you these cuts would have a devastating impact on our region. Under H.R. 1, the entire cost of CalFresh food benefits, which is $226 million annually, could be shifted to the county. Add another $50 million in new administrative costs to that, and that's just to keep up with twice as many renewals, stricter federal reporting, and work requirement enforcement. These changes could very realistically overwhelm our eligibility workers. Without immediate planning, families will go hungry simply because of bureaucratic delays. As my colleague mentioned, we must ensure we have adequate staffing to handle the increased workload, starting with the 44 current vacancies in self-sufficiency services. If we don't act, thousands of seniors, families with children, and people with disabilities could lose the benefits they qualify for because we don't have the staff to keep up with the red tape. At the same time, the proposed federal budget threatens core housing and homeless programs, including a 44% cut to HUD funding. To be specific, these housing cuts mean over 10,000 low-income households in San Diego who receive Section 8 vouchers are at risk. Housing cuts also imperiled rental assistance for 208 formerly homeless households and housing assistance for individuals living with HIV/AIDS. In a place like San Diego, housing pressures are already outrageously high. These cuts would push thousands more into instability or homelessness. The cost of doing nothing will be visible. We will see it in growing encampments, we will see it in overwhelmed ERs, and families being pushed out of their homes. We must fight to preserve programs that work, like our Innovative Housing Trust Fund, which has already funded over 2,000 units of affordable housing, with another 3,000 units in progress. Our board letter also calls for protecting tenant legal services, which provides stability and support for vulnerable renters. This program has prevented many residents from falling into homelessness, and eliminating it will only make the crisis worse. Simply put, we cannot afford to delay implementing these actions. Next Tuesday, we are directing the CAO to immediately assess staffing and service capacity to absorb these new burdens. We're calling for a plan that helps communicate the risks to our most vulnerable residents. We're also calling for a full fiscal strategy by September to ensure that we don't leave residents behind if and when federal supports fall through. Our plan is to certainly hope for the best, but plan for the worst. If our core responsibility is to provide health and human services to San Diego County residents, we need to respond with urgency and common sense. For me, this isn't just about doing the right thing, it's very personal. I have been a recipient of county services. When I was diagnosed with an autoimmune illness, it was one of the most difficult chapters of my life. And at that moment, if I had faced even longer wait times or additional administrative burden for critical support, it could have been even more devastating for myself and my family. Our systems are already hard to navigate. Adding more hurdles will impose unnecessary suffering on the most vulnerable people that we serve. We cannot fix what Washington is breaking, but we can choose to be ready, and we can choose to protect our residents. I look forward to exploring these options, including the possibility of revisiting our budget reserve policy.